There's one clinical question that we're really particularly interested in, and this is whether we can better predict how a patient's disease is going to progress at the point where they present for their initial surgery. Because, for example, one thing we're particularly interested in is whether we can better target neck dissections. So at the moment, a lot of patients get a neck dissection where alongside their surgery to remove their tumour, the lymph nodes of the neck are removed, because this is where the tumour spreads to, and we know it gives better clinical outcomes, so it's an important surgery for people to have if they need it. But we know that there's no good way of targeting that surgery at the moment and deciding which patients need it. So what we'd like to do is improve on that. And what we've done is taken a laboratory model we're using where cancer cells spread within a 3D matrix, and asking, can we develop a signature of those cancer cells which are spreading and apply that in patients to see if we can then identify which patients' tumours are going to spread. And so we took this laboratory model, we developed a signature for these cells which are spreading, and then we applied that initially to preserve patient specimens. So what we have is a whole archive of patient specimens which are preserved in formalin. And these all have linked with them the clinical data from the patient, which shows how the patient's tumour developed. Did they have a very mild disease course, or did they unfortunately have a more serious disease course where their tumour did spread? And so we can separate those patient specimens based on that and then test our signature. And what we found is that in this initial small study with preserved patient specimens, our signature is very good at predicting whether a tumour is going to spread or not. So we're very excited about this, and now we're applying for funding to develop this into a bigger study. We look at a much greater number of patient specimens to test this and check it. And if that works well and gives a really good and continues to give a really good predictive accuracy, then this is something which we'd be really excited to apply clinically, so that when patients come for their initial biopsy, they could have that tested for their signature, and that could say, great, you've got your tumour has a really good prognosis, so you could be spared a neck dissection and not have to have it. Or for other patients, it might say, actually, your tumour looks like it's more aggressive. You will benefit from a neck dissection, and they can make that decision. The clinicians with the patients can make that decision together. So this is something we'd like to be able to progress. We're really excited about to add to the clinical sort of the clinical armory, if you like, of techniques they can apply when a patient presents to better tailor the treatment to each individual patient.